Communication is an important skill to have as it can help improve outcomes in different areas of someone's life. It could be work, it could be with their friendship, or it could be with your roommates, or it could even be with a health provider. Communicating with a health provider can be very intimidating for various reasons. There might be a power dynamic, or there might even be some sensitive topics that the patient might want to talk about, but can be uncomfortable to communicate with the health provider. However, it's important to have open and honest communication as it can improve the outcome of the care that one would receive. So some tips and tricks when it comes to communicating with the health provider is be honest. So you need to be open about all symptoms and concerns. I know it can be difficult, especially if it's a rather newer doctor-patient relationship. It could be harder to kind of express all concerns. However, it's important that they know all symptoms and concerns as this can help them better treat you, and they might not miss a diagnosis, or they might be more aware of how to better treat you. And it can be intimidating. So you can kind of preface the conversation with like, I'm kind of uncomfortable to talk about this, but I know it's important, or this is something more sensitive to me, and it kind of like triggers the doctor to like maybe be more of an active listener and really pay more attention to what you have to say. And also, health providers can be trained in this, so they know how to talk about sensitive topics, and they talk to other patients as well when it comes to different issues or concerns that can be more uncomfortable to talk about. Another important thing is ask questions. Come prepared to questions with questions. If you have some questions that you want to ask the provider, write them down. This can make it easier as you might not forget, or if you're kind of nervous to ask these questions, you can provide them to the health provider, and that can kind of give them a list to kind of talk off of. And then throughout your appointment, ask clarifying questions. The doctor might use a word, or they might start talking about something and you're not really sure exactly what they're asking or saying. And then you can ask, like, what do you mean by that? How does this affect me? Just so that you have a better understanding. Because in the end, this is your health and your concern. So you need to be able to handle whatever it is that the provider is providing you. If it's medication, you need to know how to take it appropriately. Um, and then kind of going off of the questions is restate what the provider has said. But don't use it in their own words. If they say something and you're not sure, or you want to make sure you fully understood that right, you can kind of restate it in how you understand it, and that will allow for the provider to be like, no, that's not exactly what I meant, or that's exactly what I meant. Like one could be like, oh, you have high blood pressure, and you could, somebody might think, okay, as soon as I have high blood pressure, I need medication. So they might say, so I have high blood pressure, and what you're saying is I'll have to take medication. And then that's where the provider can be like, yeah, that's exactly what I'm saying, or well, no, you can control the high blood pressure with other ways, and then maybe medication in the end. So it's just really important to restate what you think the provider has said, to allow for you to one better grasp what they're saying, but then also kind of clarify what's going on. And then if you're uncomfortable with a treatment option, or if you've been provided with some information but there might be other options, don't hesitate to ask about alternative treatment options or medications, as this can better um, help provide the provider with a plan of action, because maybe the first treatment option isn't what you want, or it doesn't follow your belief systems, especially when it comes to medication. Some people prefer more of a holistic approach, and the provider needs to know that. So going from the tips and tricks of communication, there are different communication styles. So the first one is passive. So passive is usually when somebody's soft-spoken and they don't usually express their needs or wants. And when this comes into the healthcare setting, it can be intimidating to express exactly what they want or what they're feeling, as when a provider might prescribe a treatment plan or a medication and somebody's uncomfortable with that, it can be kind of scary to speak up. So this can lead to treatment plans that somebody might not want to follow, and they might get prescribed medication but don't follow it because it's not what they want. And then they don't really get to determine for themselves what type of care that they want. And in the end, it is your body, and you get to choose what is done to it and what you get to put into it. So it's important to understand what that passive communication looks like. On the other hand, aggressive communication is when somebody's easily frustrated and they kind of, it's more of like a disrespectful tone, so it's kind of leads to more yelling, and it kind of can set that relationship, doctor patient relationship, more strange, and it can cause the provider to provide less adequate health care. So these are kind of the very like different polar opposites communication style. And then the assertive is, somebody usually listens without interruptions, but it's also standing up for your own rights. So you listen, you kind of take in what the providers say, but then you kind of express your own feelings when it comes to something. So it's usually like when, it might come down to when a provider is prescribing a certain treatment plan, and that you listen to exactly what it is, what the time frame is, what the side effects might be, how long it might take to recover, whatever it is, and then you can ask kind of questions, things like that. But then you kind of like express your concerns, so like, well, this is my concern about it. And the health provider is more willing to talk to somebody when you're expressing your own feelings about something rather than just yelling. Kind of like a quick example of an aggressive communication would be like, I don't want to take that medication. When you have this more assertive communication, it's like, I'm uncomfortable taking this medication because of the side effects, or um, I don't want to take medication as I feel a more holistic approach would be appropriate for this situation. So it's really just understanding how to communicate with your spouse, and it's important to know what style you have so you can recognize it and then try to alter it a little bit to be more assertive rather than passive or aggressive. So, kind of a way to become more assertive is using I statements. So, this is a technique to help with assertive communication, and it kind of reduces the blame of blaming the provider or whatever the situation is, and you're incorporating your feelings. It's like, I feel upset or I feel uncomfortable. So, it's usually you put I feel an emotion and then kind of explain what that is. So when it comes to the medication, is I feel uncomfortable taking that medication as I've been on the past, and it had caused these side effects. Now the provider has a little bit more insight of the uneasiness of it, rather than I don't want to take it, because it kind of puts that wall up. So these I statements can really help. Like, once again, it's not blaming; it's kind of putting your emotion in check, and then also providing the provider with some information to why something is uneasy to you or whatever the situation is. So kind of some benefits of assertive communication is, one, it improves that communication. It doesn't put up a wall, it doesn't leave unanswered questions, things like that. So it's really important to have assertive communication, as it can help improve your treatment outcome and overall your health. But then it helps for you to understand and recognize your feelings, and then to be able to verbalize it. Because if once you are able to recognize how you're exactly feeling and understanding of the situation, you can then go ahead and express those to the provider, which now gives them a little bit more insight. And like I said before, it does improve the outcomes of your treatment plan, your health, whatever it would be. And then it also kind of creates more respect for yourself, because now it's like, okay, I'm being heard for what I want. And then some tips to becoming more assertive is, assess your style. Are you a passive? Are you aggressive? Are you a mix of both? Do you have some assertiveness into it? What areas do you need to change to become more assertive rather than passive or aggressive? And especially for somebody who might be more passive, it's important to maybe rehearse what you want to say. Have those questions written down and bring them with you, but then also rehearse, like, hey, I want to talk about this today. These are my concerns. And it's also important to use body language. as this can also help bring out your emotions, because now not only is the provider hearing what you're saying, but they're also seeing it. So now it's really emphasizing them. Okay, they are really frustrated with the care that they've received. Um, but then it's also important to keep your emotions in check. Once you start to get really upset or angry, then that can lead to more aggressive communication, or it could cause somebody just to shut down and not really ask or say anything, which then kind of puts you back in the beginning of not really getting anywhere. And then the biggest thing is listen actively. So there's a difference between just hearing things. Hearing is more of just the activeness of hearing sound, when listening is taking in what you're hearing and actually decoding it and really understanding what's being said. Thank you for taking time out of your day today to watch this video on assertive communication. I just kind of want to emphasize that I did mainly talk about health providers and communicating with a health provider. However, this skill can be transferable. You can use this with your friends, you can use it with a coworker, you can use it with a roommate, you can use it with in any area of your life. So I want you to know that you can take this information and use it within any realm. I have provided my email and my phone number just in case you have any questions, comments about the video, or you just kind of want to talk a little bit more about how to improve your assertive communication. I do have some Word documents about assertive communication, some practice for I statements, and even some like worksheets about bringing in questions with your health provider. So if these are any of interest to you, please reach out to me and I can provide them to you either in an email or I can mail it out to you. So once again, thank you so much for taking your time out of your day to watch this video.